Hi, I'm Dr. Rudy Cashman. I'm going to speak this evening about a very interesting subject: preventing, stopping, and reversing and curing type 2 diabetes. It's a wonderful story that you can indeed be relieved of this disease. I'm a wellness doctor. I've been a neurosurgeon 40 years, but a great deal of my teaching really at this time has to do with wellness, because I see so many type 2 diabetics. The other day I had 15 patients in my office, and 8 of them had type 2 diabetes. So I've taken a great interest in this, and already have written some books. You know about the diet one, The Secret of the Non-Diet for Adults, and I have another one out called The Secret of the Non-Diet for Children coming shortly. I have with me today Susan Henry, my friend, who also works part-time with me, who has had a great result from practicing wellness, and I'll have her speak to you in a little bit here. I've been in neurosurgery 40 years, but I'm only 39 years old. And I practice wellness, I really do. And this is going to be a lot of fun. Let's first speak a little bit about why we want to do this. Why we want to do this. It's very important. So we're going to go through a little bit of bad news here for a little while, but then we're going to start telling you the good news story. I'm very excited because I have found that you can get rid of type 2 diabetes. I have patients in my wellness programs have gotten rid of the disease in 30 to 60 days. Sue is a great example of it. So this is good news for you. Diabetes is the greatest cause of blindness in this country today. We have 30,000 people in the United States that become blind a year from diabetes. Not a very good story. And many of them, hundreds of thousands of them, are partially blind. Diabetics also have a higher rate of glaucoma. They also have a much higher rate of retinal disease, especially vascular disease, cataracts. They have a much higher rate than a non-diabetic individual. Diabetes is a great cause of obesity. 30% of the people in the United States are obese. 60% of the U.S. is overweight. And we have in this country 30 million diabetics. We have another 60 million that are pre-diabetic. It's a huge epidemic. Can you imagine the illnesses and the cost involved? We are doubling our type 2 diabetics every 10 years. Can you just imagine? Someday we may have 200 million people who are pre-diabetic or diabetic. A very unhealthy situation. And it's from eating the wrong food. We're going to give you the good news about what to eat to get rid of this disease. People with diabetes very commonly have heart attacks. 75% of causes of death in diabetics is a sudden heart attack. And you just no warning. Not that they have angina or jaw pain or arm pain or anything like that. They grab their chest and they die. 75% of the diabetics, a huge number. And that's because they develop vascular disease. We see a lot of paralysis and strokes from vascular disease from diabetes. They're very common. And at a young age, diabetics have these diseases about 20 years before healthy people might occasionally get them. Also, we have a lot of amputations because of this vascular disease. It's the sugar that attaches to the proteins in something called ages, and this causes small vessel disease leading to gangrene, amputations. They cut off the toes and then the ankle and then the leg, very commonly. About 82,000 a year. About 82,000 a year. There's an increased rate of cancer if you're overweight. 20% of breast cancer is due to obesity. Prostate cancer, much higher in diabetics. And it's due to the fat chemicals in fat. There are 20 nasty chemicals in fat. And that's what causes increased cancer rates, the increased vascular disease. And then we have peripheral neuropathy. You've heard about this, diabetic peripheral neuropathy. Not uncommon. You get numbness and weakness in the arms and legs, and I see cases of it. And the pain is so severe, you feel like they have a ruptured disc. But because you get numb and you get weakness, your joints start dislocating. And they have horrible complications if the foot bones become dislocated and